Taking away dental coverage for adults or children is the worst thing anybody could do.
It's a travesty of what the government has done in terms to underserved communities, which are being affected the most with the cutbacks.
Recently I had a patient, she was 34-year-old female who came in for dental treatment. She needed 4 restorations. Prior to last year, I think July, the treatment would have been covered because at that time restorations were covered for a patient who had Medicaid. But at this point they're no longer covered, so she did have to lose those teeth because she couldn't afford to pay for the entire treatment.
I just had a patient the other day, 91 years old. She fractured her front tooth off. She was not in major pain, but she was unable to eat because she only had a few remaining teeth left, and she had no way to cover replacing this tooth to function and chew.
If we're cutting Medicaid because we're trying to save money, we're not doing that.
Since the removal of preventative dental care from the public aid patients in Illinois in 2012, these patients are seeking treatment at the ER that's costing taxpayers 10 times more than it does for them to come to our office and have regular preventative dental care.
The difference that I've seen since the cutbacks in 2012 is in the dynamics of my patient flow. Adult coverage has been alleviated, so therefore a lot of the patients, adults are just not coming in unless it's for an emergency purposes. And it's also affecting the children as well because there are no coverage for the adults. Basically, there is no means for transportation for the children.
We all knew that the adults weren't going to have the care after the benefits were removed. But what we didn't foresee was that the lack of the children receiving the benefit as well. Because when the adult doesn't have the coverage, a lot of times they don't bring the children either.
I'm Dr. Dan. I'm going to take a look at your teeth, okay?
Okay.
Anything been hurting or been bothering you?
No.
There are patients having unneeded suffering that could be easily avoidable with minimal taxpayer money by providing preventative Medicaid adult dental care for the patients.
Bringing back preventative basic services, or coverage for services, that's what's going to really save us money.
I just really think that our legislators are really forgetting about our lower income population. They're the ones that really need the help, especially at these hard economic times.
The state of Illinois should reinstate this back, okay? They need to cover the adults. If you don't take care of your own people, who will?
It's something that should not be even a priority in terms of cutting. It should be a priority in terms of saving.